The wide world of wellness. So many topics, so much information, and sometimes misinformation. Here, we're going to explore the complicated and sometimes confusing trends in wellness. Welcome to How Wellness Works. When it comes to the adrenal glands and medicine, Addison's disease or hypoadrenal function and Cushing's disease or hyperadrenal function are pretty well established and well recognized disorders. However, the remaining spectrum of adrenal dysfunctions remain mostly overlooked in the conventional medical community. So, does adrenal fatigue exist, and what exactly is it? First, I think many practitioners use the term either adrenal fatigue or adrenal failure to identify the complex array of symptoms their patient is having, presumably related to the dysregulation of the hypothalamic pituitary adrenal, or HPA, axis. What does exist is a syndrome with several phases and many different manifestations caused by dysregulation or dysfunction of this HPA axis. Now, common symptoms include, but are certainly not limited to, cognitive deficits, depression, fatigue, hormone imbalances, hypoglycemia, hypotension, an inability to cope with stress, insulin resistance, irritability, a suppressed immune system, decreased libido, sleep issues, and weight gain. The predominant theory of what causes these symptoms of dysregulation develop when the adrenal glands, which are our stress glands, are unable to keep up with the demands of the multiple, compounded, and confounded stressors in our modern day. Relationship stress, unresolved emotional issues, financial stressors, environmental stressors, work stress, you name it. These days, it does pile up. You see, when a stress is perceived, the hypothalamus initiates a chain of commands that eventually result in the secretion of cortisol. That's our main stress hormone. And in the short term, this heightened release of cortisol is a highly adaptive response that prepares the body to deal with the perceived stress. So if this mechanism continues in times of chronic stress and cortisol continues to be sustained, it leads to an array of maladaptive physiological responses, including hyperglycemia, insulin resistance and diabetes, hypertension, increased risk for anxiety and depression, and more. So, what can you do? Well, there's a lot. There are many dietary and lifestyle measures, along with nutritional supplementation, that can really help if you find yourself over-adapted. So first, avoid caffeine, sugar, and processed foods. Make sure you are eating a whole foods diet that is plant-strong and full of clean, nutritious protein and good fats. Make sure you respond to any fatigue with rest, trying to get at least 8 to 10 hours of sleep, preferably between 10 p.m. and 6 a.m. Decrease stressors as much as possible. Eat small, frequent meals to make sure your blood sugar stays stable, and consider taking nutritional supplements. I mean, just to name a few, because there are many depending on your specific situation. Adaptogenic herbs such as ashwagandha, rhodiola, schizandra, and holy basil are wonderful to help adapt to the multiple stressors and lower cortisol. Magnesium has been noted as one of the necessary nutrients for fighting adrenal insufficiency. B-complex vitamins. Many of these vitamins get depleted during times of extended stress, so supplementing with a full-spectrum B-complex is very important. Vitamin C has been known to mitigate the effects of chronic stress, and no other tissue in the body uses vitamin C like the adrenal glands. Also, vitamin D. In addition to maintaining homeostasis between magnesium and phosphorus, vitamin D, of course, supports strong bones and has also more recently been seen to have an impact on other conditions, including adrenal dysfunction and disease. And that, when it comes to adrenal fatigue, is how wellness works.